Welcome, everybody, and thank you for joining us today, and thank you for asking me to present. So I've gathered information from webinars, surveys I've done, for interviews, and this next few slides is going to give you an overview of it, and any more particulars, please feel free to email me. So starting, we know healthcare operators are getting hit hard. Different parts of the country are getting hit harder now at this point, but we're all getting hit from different angles. Visitor meals have almost stopped. Employees are being transitioned to remote, the ones that can be. And so it has become a never-ending kind of challenge. There's a lot of corona fatigue around, there's compliancy to complacency, and what's happened is there's not an endpoint at this point. So a lot of people have said, you know, what do I do? And so as you can see, they're open for business, but they have to help raise revenue. They have to look at ways to keep still food safety, take care of allergens, as well as keep patient care and wellness. So one of the things that has come out of COVID is the reimbursement availability. Next slide, please. The reimbursement availability. This has come out of COVID, and the GL coding for reimbursements has allowed people to purchase, renovate, reconfigure cafeterias, virtual spaces, 3D printers, different equipment, anything that's related to a COVID type of patient, either now if you're in the midst of it or you're preparing for another surge. They have used coding for hazardous pay, double overtime, disposables, and you have to have at least a 3-month supply. But in addition, many people are using it to prepare for feeding a COVID or isolation patient and the funding and renovating so that they can bring people back into a cafeteria. And if you're not aware of it, there's some other grants going on as well, but just be aware of this COVID. So impact of COVID is obviously increasing time and products for sanitation. Physical distancing, no doubt about it. They're distancing back of the house, front of the house. Labor, they've had to furlough people, and now they can't get back the labor they want because again, people are looking for different types of jobs. They're not always coming back. So labor shortages are happening now within healthcare. The impact, use of technology, robotics, and informatics, and we'll talk a little bit more about that. Could you back up? Gives you an opportunity to evaluate your work environment now with the impact. Look at your design, your back of the house, how you're getting food to your patients, to your staff. The supply chain challenges. There's going to be food shortages, and there's going to be increased pricing with supply and demand. Sustainable packaging. A lot of that has gone by the wayside at this point because of the need for isolation and also grab and go. Impact was in delivery and contactless, and buffets, self-service, and salad bars. So these are the areas they need solutions on. And remember, they're going to be budgeting for 21, and so they're going to require you to help them analyze their building layouts, staffing, help them engage as a business partner on how they can resolve some of these challenges. So COVID has caused disposable costs to skyrocket, and they didn't budget for this. So you have to realize some facilities went from $4,000 to $12,000 per month. And those disposables, and budgeting for disposables, delivery vehicles, cooling shelves, heated shelves, all those materials were not budgeted for, but they had to buy them on a very reactive basis. And at that time, the grants weren't implemented. Now the grants are, and this is the impact. So they will still need more disposables. They will need the ability to have delivery vehicles, whether they're driven or robotics. They'll need the ability to have cool and heated shelves, and to have trucks transport meals between buildings and between towers. Another impact was labor costs, which I've spoken to you about. It's about 6% rise in hourly labor costs due to the single site staffing. And what I mean by that is that if you have a single hospital, you probably didn't have a rise in the cost, maybe with OT, but that was covered by the COVID grant. But if you have multiple sites or multiple health systems or multiple senior living where you use one employee for one day and maybe use them in a different day somewhere else, that has changed. And what has happened is that because of safety and priority, they've decided to just have one person work in one facility versus transmit things. So again, that's where the 6% rise came into being. And also things like feeding people salad bars, ice cream stations, and self-service points changed. So they needed people to man those kind of things. And again, that's where your pricing went up. So be aware when their cost, if you can offer any kind of equipment or any kind of reconfiguration that can help them offset some of that, yet give them the quality and also the customer experience, you'll have a win-win in that component. Another impact was food and equipment costs. And most dining leaders have found food costs to be lower or flat compared to last year. But however, not knowing what will happen in the future, they have said the top 3 areas they want manufacturers and distributors to help them in is to lower the purchase minimums between equipment and food, help them with new products and solutions that will help them and enable them to be transparent and to continue increased sanitation and safety. And they want more purchasing discounts or rebates, especially with items related to their solutions for COVID and beyond. Some of the surveys and interviews, I asked them, what is the biggest challenge moving forward? And their biggest challenge still needs to be communal dining and dining footprint. How do you set up the dining room? How do you offer somewhat of a community? Distancing in the back of the house and the front of the house. A big thing that's been going on now, especially in the Northeast, is staff morale and safety. Everyone was very concerned with frontliners, as they should be. However, you had a lot of food service staff that didn't feel the same kind of love and attention. And what has happened is it has become an issue, and food service directors are finding that they have to kind of motivate their people and feel comfortable. And so I'm going to give you some ideas on how to approach that. Regaining confidence in food safety from the customer point of view. Revenue, obviously, retail venues have got shut down or have been limited, so the revenue has been challenged. And food quality. Temperature and presentation between patients and residents and staff. How do you retain it with the equipment that you have? How do you retain it with the grab-and-go kind of component? And how do you retain it with the isolation, specifically the COVID patient? They still want safe person-centered care. They still want the sanitation. And the other challenge is the unknowns. Not having a crystal ball or an unknown has been a real challenge for them. And those are things to be aware of. So some things that have come out is there's new building kitchen codes. And they've talked about this, the pre-clean sanitizing area and receiving areas with sinks, maybe even refrigeration out there or freezers, having a stainless steel table on the inside of their delivery areas, more storage, dry racks, and frequent sanitation. The reason this has all come out, it was starting to come out pre-COVID, but it has obviously got exaggerated, is because, again, any way you can limit cross-contamination or the virus traveling by letting people who deliver drop it off and not come into your facilities is kind of be the protocol for the probably next year. I don't know what will be after that, but I know that for now, they are looking at things to heighten it so that they can minimize any kind of contamination. Some other things that are going on that you can be aware of is how do you buffer between the back of the house and the front of the house? And some ideas that have come out of it, out of speaking to people, is having expediters as a buffer between those who can touch food and those that cannot, especially on the tray line. Designate separate entrances for the front of the house and the back of the house employees. Visual cues, different colors for gloves, aprons, and head coverings if they're front or back of the house. Again, the more designation and transparency, the less problems or the less minimizing of the problem. Front of the house, how do you keep your staff safe in a way and your customer having barriers? Maybe a table in front of a beverage station that is being served from, using furniture and location of furniture. having your staff eat in a different area from your visitors, minimal visitors, having your staff eat differently from nursing, disposable and digital ordering, and minimal contact food delivery. Think about installing it. Somebody was recently said in the UK, they noticed an electrical fence in one bar to keep people back from the bars. Well, I'm not saying put an electrical fence, but certainly something that can designate that, hey, don't step over this line. This is our safe zone. And they are considering more and more things. So consider buffers. That's a new term, back of the house, front of the house, buffers. What buffers can you implement to make this safer? Another thing that's going on is the kitchen is the heart of, obviously, every restaurant, every food service. And the problem is, what do? How do you minimize connection in the back of the house? A big challenge in one of the hospitals in Oregon is that before PPE was required, the whole food service staff, about 14 people, had to be quarantined for 2 weeks. So you lost your whole back of the house crew due to, again, lack of PPE, lack of understanding and protocols. So what many facilities are thinking about doing is taking some of the food prep from the back of the house to the front, even though now you have the PPEs, but working with more action stations, mobile prep areas, some of the multi-tier kind of items that you can put in the front of the house and show people how you're cleaning. Example is a Japanese restaurant doing some prep, and in the restaurant, it was noted on the internet, is that even though they clean it after each meal, they decided to sanitize it as the people were surrounding it. So again, that transparency. Having this front of the house food prep allows that to be happening. Some other things, future code requirements may state certain amounts anticipated in the kitchen employee, and UV lights are becoming big in coolers and storage areas, as well as in sometimes customer space, because they kill off the virus, the COVID-19 virus. I also started to see UV lights in Whole Foods, using for door handles, packages, and freezer doors. Again, all related to the windshield ahead. How do you keep things safe? Safe is a kind of keyword in the ambience of the future. Some other areas you may have not considered is the dining office. Oh, let's do back of the house. Sorry. So one of the other things with back of the house is, if you see the green configuration there on the screen, that's where you can put in these dividers. And so, yes, it may not be 6 feet, but it is a distance, physical distance, and you get increasing morale, saying we care, also helping those people mitigate any risk. They're clear, so you can see. And so that's something that has been considered in some back of the house. How do you make your back of the house environment safer from a realistic point of view, as well as from a morale point of view? Some people have told me they're starting to do that, but the problem with the shields and the masks is that they can't hear or communicate. So some people are starting to think about having some kind of, they're looking at some technology, technical communication, so that they can hear clearer from, especially the cooking area, back to the front of the area, because if you're having distancing. So things to be aware of. Even though you're instituting these things, you still have some other challenges that will come out of a distancing, especially communicating, hey, I want medium well, this hamburger, etc. So the other area that's also back of the house is the diet office. And what was happening is diet offices are really a kind of a hub of where technology and diet clerks and some of your dietitians are. And so what was happening is you didn't have a way to mitigate because you didn't have a lot of room. So some facilities have put them in separate rooms, some are allowing them working remote, and some have put up these dividers as a first stop. So be aware that between the mask and the dividers, it's mitigating, it's not eliminating, and there has to be a better way to do it. But what a lot of these directors felt that if they wear the mask, the probability for getting sick less with the flu season and COVID would be less. But again, the more you can come up with solutions for that diet office, especially when it's the hub of a facility and it's not separate. Other things that have been going on in healthcare is meal service modification, specifically hospitals that really had to turn on a dime and really get food out. They weren't serving it on plates. So these are meals that were served to patients, and they had to use disposable wares for full house. Not only COVID, some hospitals were lots of COVID, but full house. And so they had to make it look appetizing, but remember how many disposables they're using. This one is using a tray and a bag, but some of them had to use disposable trays. So meal service modification, when you look at your menus and how you had to modify menus, both for back of the house and the front of the house, you also had to make sure it was going to look good in a container, retain the heat, and be able to be delicious when eaten. Other challenges, as we spoke about, was the supply chain. Again, supply chain not only from food, but from disposables. People are stockpiling right now 3 months supply, because if it comes out, they won't have the supply. Well, they're having a hard enough time getting the 3 month supply that's in-house because they can't get, there's a lack of styrofoam trays, to-go containers that retain heat. And then they said to me, how do they stage and hold these temperatures in these disposable containers? If they use a heat lamp and they're using styrofoam, well, you know what happens. So they're looking at bento boxes that are disposable that are more high temperature. They're looking at different ways that they can retain the texture and taste of these products. I mean, it's a whole new world as they move forward. Eventually, some places who have less COVID right now went back to China, but many are still stockpiling these kind of items, and they know that it'll become a challenge again if there's a surge. So dining rooms have been disrupted. And so here's some ideas. 56% of healthcare operators reported food sales are down. So some ways to increase your revenue is to do outside dining, just like you do in all of the restaurants. Ordering food via smart devices, pop-up indoors retail on the way out after somebody is getting a procedure, or a visitor, if they're allowing visitors, is not going to stay in the hospital, be able to have a pop-up and get some food and leave. Modifying your menus and hours, reflecting on what cases you have of COVID and what your staffing models are. And it's okay. You can have a modified menu. If you're doing a menu, pick items that you do great and make them great. Hours reflective of it, and maybe have alternate vending or robotics or Sally, with different things that can implement or complement. Put your plexiglass dividers out there, limit the seating, stagger meal periods for staffing, because then you can allow people to come into a cafeteria, and make sure you have lots and lots of floor and staff signage. I think the biggest thing, what I see in healthcare, they've got it right, but I see it in retail and restaurants, they don't have any signage. They don't say wear your mask. They don't have anything on the floor. And that's really, if people aren't communicated clearly, you know what happens, chaos. I just wanted to show you this layout. This layout kind of gives you an indication of the pre-COVID restaurant layout and post-COVID. And I know it's a restaurant, but the idea is this is something to consider both for your cafeterias, your restaurants, college and university, non-commercial and commercial. Think about considering this. It's going to happen for the next year and a half. People are going to feel need that confidence builder. And so think about these ideas of implementing kind of with that image, and so you get the loyalty, the customer, and people feeling safe. These are great depictions of what I think I know many of us would feel safer eating in an environment like this. Obviously, this is indoors, but obviously a lot of us are eating outdoors. But when you come indoors, how you can implement it and make it safe. And the big key here is transparency. Let people see what you're doing. If you have a pre and post, show people visual, social media. The other thing is some upgrades that will be implemented with retail, looking ahead, is obviously you're going to have condiment stations and utility stations that are individualized. You won't have, obviously, the ketchup pump. Even though that some say that it's an automatic pump, I don't think the safety component of it will be there for people. Again, perception. You'll have more prepackaged silverware, more glove dispensers, more physical barriers, self-cleaning equipment, touchscreen robots, heated shelves and delivery stations. These are going to be necessary upgrades as we move forward. To go with the go approach, grab and go, you have to make sure it's identifiable. Packaging, sometimes you'll have double packaging, like some of these sandwiches were put into a box, but a lot of people have claimed that they would feel good if it's wrapped and then packaged. So when it's a sandwich, that, again, it's that safety perception. It may be safe according to the CDC, and it may be safe according to your infectious control. However, they won't choose that food item if they're not going to feel safe about it. So choose your boxes wisely, temperature wisely, stage them. Use these salad bars to stage them, identify them, and make sure you consider packaging. It may not be the same old packaging, and that's a real consideration of safety. Otherwise, you won't sell it, and therefore gain your retail. Other things that are going on is people back, the home meal replacement. A lot of staff has kids back in school now, and with these staff and the home away meals. So that's another way you can increase retail revenue is by offering these things. A lot of people are doing it, these meal delivery components, they get delivered to your home. But if you were able to offer it in the hospital, pop-ups, groceries, these kind of approaches, this would allow you to, again, gain your reputation, gain loyalty, and offer people a value add and increase your revenue in doing so. There's some creative things that people are doing out there, and I think this will only grow as people don't have time to make another stop and they want to mitigate their risk. One of the things that I saw out there that I thought was pretty interesting was a new delivery model, kind of a European model called a shaker station. And basically you have all the ingredients laid out and someone's behind there, and basically they choose it, then you put it into kind of a shaker, and then you give them choice and customization. It's like those salad bars kind of mixed, but here it's behind, that's kind of the European display cases. So you're using equipment that typically may be used for something else, and having safe distances. So these are great ideas. Look at your equipment, what you can do, how you can recommend other people to do. Look at the equipment they're using and give them these ideas of repurposing them. Another thing that I saw that I really enjoyed seeing was these pop-ups in food lockers. You've got a bunch of companies that have food lockers. Some of them are ambient, some of them are cold, some of them are hot. They can be a combination, different heights, different sizes, to hold and retain the temperatures in these disposables. They can be contactless, touchless. Again, great things out there. And I think these will stay because this is a great opportunity, even when things get back to the new normal, to have food available and not have to have someone waiting there or a pickup counter where food gets cold. The other thing is these pop-ups. They have been great. They have gone from very large to very small, but depending on what population has COVID or how much what is going on there. Another thing which I really loved is the repurposing of using a delivery cart in between mealtimes and bringing food up to the staff. How great is that? Bringing it to nursing stations, bringing it to visitors, increasing retail volume, and also building relationships. Great ideas. Another thing that will continue to happen is social distancing. So again, these are some ideas looking around between the signage, and you can see the physical distancing. Again, easy solutions. Some things can be hung from the ceiling. Choose your materials for ambience and safety and for cleanability. Prefabricated things, visually seen. Again, I use the term social because it's been used a lot, but I still like to use physical distancing because we're such a social being. But physical distancing is here for a while. It may even help reduce flu season, but it is here for a while. So think about ways you can help your people come up with different ways to give that food safety. So in summation, the journey ahead is about prevention. And back in April, one of the senior livings in Lincoln, Nebraska, purchased robots that use UV-C lights to disinfect areas. You can see it on the right side. They're called germinators. And they've never had any cases of COVID-19. They've used it in their facilities, throughout their facilities. So now they're setting aside funds for purchasing plexiglass, creating separations in the dining room, and to, again, be proactive versus reactive. Accelerate your initiatives, your quality control, look at the quality control, look at it through the eyes of your customers, your residential patients. But here are some ideas that I put up on, and you'll be getting a copy of this PowerPoint. So these are ways for prevention and being proactive and to continue to be proactive as you go ahead. Some ideas from equipment possibilities and for long-term care is using the CZQ carts to bring food to each resident, increasing the communal feeling, happy hours, the ice cream, the snacks, healthcare, tray line physical distancing markers, as well as maybe using vertical space such as a starter station to accommodate more supplies for trays. an isolation cart to hold all masks and PPE. Quantity, more room service carts to modify the room service to let people out in a smaller period of time, touching more people. Delivery options, physical barriers in your diet office. In healthcare, some of the ideas I thought of were disposable wares, holders, having holders available, merchandising cards, micro markets, coupled with other business partners with technology, pop-up grocery retail, open air dining alternatives, having heating lamps outside, because if you can go further and give people a safer alternative, they're going to eat there and they'll come there. All-terrain carts to transport to different locations. If you're missing your salad bars, find ways like Sally Robots, and there's a farmer's fridge. There's lots of things, and you can put the lakeside tables next to it for pudding and portable countertops for staging. The hand washing thing, I know the portable ones, the ones that have stop timers that tell you 20 seconds. Another idea is the ability to stage food areas to make trays or finished meals. Storage for packaging. There's no place to put these packaging. It's holding it back of the house. Physical barriers. Again, these are some equipment possibilities. Food lockers, virtual, using a closet space to do a virtual retail kitchen, doing ghost kitchen. So these are the possibilities to continue to think about prevention in healthcare. Again, challenges you're going to have, give them options, pivot, and move forward.